for the introduction.
Great. Thank you, Andrea. I'm just going to start by introducing this afternoon's session. It's lovely to see so many people on this call. I thought I'd just start by asking people to raise their hands either in the traditional way, I'm going to do it like this, but you can do it the digital way, if you've actually got bats in your house at the moment. I see hands going up. It's quite a lot. But there's also quite a lot of people here who perhaps are just interested in finding out more about bat rehabilitation. And we obviously come to this from varying perspectives. So when bats come into care, we're thinking first and foremost about about the welfare of the individual that we're dealing with, but also what we do, the way that we respond to that bat, and whether or not it's then replaced into the wild. That has implications for conservation as well. And finally, there's also implications for ourselves, and it's important that we're all that when we handle bats, that we do so in a way that's not going to be harmful either to the bat or to ourselves. So that was really the springboard for doing this webinar today, was to think of this One Health perspective where we're sort of turning around all these ideas about bats coming into care. And I'm absolutely delighted that we've got Heidi Hargreaves, who's a wildlife vet, who's going to basically be our expert on this event today. I also just want to introduce Bronwyn, who is a postdoc at the University of Sussex, who's working. Here she is. She's mostly going to be taking the floor and leading the rest of the proceedings. I should have said I'm Fiona Matthews. I never said that. And I'm one of the leads on the OneBAT project, and also a bat researcher, and yeah, kind of accidental bat carer, I suppose. Right, so I think without any further ado, we can move straight into Heidi's talk, and she very kindly pre-recorded it for us, partly to avoid any issues, any technical issues, so we know this is going to work. And then what we'll do, so the order of things today is we're going to hear part of Heidi's talk, then we're going to have a short interlude while we're going to ask you some things, then we're going to hear the second part of Heidi's talk, and then we're going to have a question and answer session. So off we go. Over to you, Bronwyn.
Evidence and welfare. My part focuses mostly on the vet and rehab journey. Good evening. Thanks so much for being here. I'm Heidi Hargreaves, a wildlife vet based in the UK. Tonight, I'll be walking you through what from rescue to release looks like in real life, with practical strategies for triage, care and release built on evidence and welfare. My part focuses mostly on the vet and rehab journey, but it's just one part of a much bigger puzzle. And I'll highlight where we need more data, especially post-release. So who am I and why am I talking about bats? Well, I've actually been involved with bats for a couple of decades now. I started in my 20s as a rehabber, and I've had a few bat adventures along the way, including a very memorable trip to Honduras where I got to hold a vampire bat as well as many others. And to my absolute delight, I actually met my husband, Daniel, in a bat flight cage in London. We were flying juvenile bats together. How romantic, hey? He's now actually a bat conservationist and the bat program manager at the Vincent Wildlife Trust. And yes, most of the decent bat photos in this talk I've pinched from him. Perks of being a cheeky wife married to someone who works with bats full time. And these days, I'm a wildlife vet at Vale Wildlife Hospital. I trained at the University of Bristol, and I'm just one module and a dissertation away from completing my MSc in conservation medicine at the University of Edinburgh. which has really helped me connect clinical decision making with long-term conservation goals. I also run a side project called Wildlife Vet Bites, which offers bite-sized practical training for vets and nurses working with wildlife. That's really the spirit of this talk too. Practical strategies, realistic tools, and a strong focus on welfare and outcomes. I won't read out every point, don't worry, but here's the flight path. We'll start with why bats end up in care, who's involved, and how we make those early decisions. Then we'll focus on what we actually do and why evidence, or sometimes a lack of it, really matters. And finally, we pulled it all together with the one thing that makes any of this work: collaboration. Because at the end of the day, bat conservation isn't a solo flight. Often the question is asked, do bats matter for biodiversity? And honestly, wouldn't it be lovely if animals didn't have to justify their existence at all? But since we live in a world where data and outcomes matter, here's what we know. Bats are incredible insect controllers. One pipistrelle can eat hundreds of insects in a night. In some regions, their pest control can even be shown to save farmers billions in crop protection. They're also long-distance seed dispersers. Yep, get that there. And flying over fragmented forests and replanting them from above. And some bats are major pollinators. Over 500 plant species depend on them, including bananas, mangoes, agave, and guava. That means bats quietly support food security, forest health, and ecosystem stability, all while staying largely invisible to most people. So yes, if there was a Nobel Prize for ecosystem services, I reckon bats would absolutely be in the running. And because they're so important, bats are legally protected in many countries, including across UK and Europe, under domestic law and international agreements like Eurobats. That means disturbing, handling, or keeping a bat without permission is usually illegal. But that doesn't mean you can't help an injured bat. If you're ever unsure, get advice from your local bat charity, carer, or conservation group. Understanding seasonal behaviour is one of the most underrated clinical skills in bat work. In winter, bats are hibernating, and you'll often find cold, quiet individuals that aren't actually dying, just torpid. Come spring, maternity colonies form, and by summer, we're seeing pups. And in autumn, mating begins as they fatten up for hibernation again. Season changes everything, from what weight is normal to hydration needs, drug metabolism, and whether a bat should be reunited, overwintered, or released now. So if you're only asking what's wrong with this bat without considering its ecology, you might miss something really important. So let's take a quick look at some of the reasons bats end up in care and how different those cases can be. So the first group we've got is disturbance cases. There you go. Bats found roosting in sheds or trapped after being accidentally shut in. Sometimes it's renovation work, sometimes they have just picked the wrong place to sleep. Then there are the injured bats. Cat attacks are unfortunately common, as well as wing trauma from collisions or entanglement with netting, tape, or glue traps. Then this group can be a little bit harder to assess. So the unwell contains their emaciation, for example, infections or signs of systemic disease. Now, sometimes it's a secondary issue, other times it's the whole problem. And then juveniles, finally, the orphan pups, the young bats separated from mum, or failed flyers who just weren't quite ready, bless. Whatever the cause, though, the most important thing is just to double check that, they could just be cold and exhausted, and not actually dying. So before we dive into triage and treatment, I want to pause and show this, because bat care isn't just about what I do as a vet, it's about a team effort. And everyone here likely plays one of these puzzle pieces, from the rehabilitators and transporters, researchers, vets, ecologists, local authorities, charities, the members of the public, and even the builders who stop work because of a bat in the roof. Together, we build the bridge from rescue to release. And my part, this talk, is focused on the vet and triage piece, but every other piece on this slide matters just as much. So when you first hear about that, Pat, it usually is via phone call, and the first questions can really make or break the outcome. We start by thanking the finder. They're already made a huge difference just by calling. Then we gather basic details, who they are, and crucially, has anyone been bitten? Because that affects the next steps for safety and referral. We then move on to the bat details. Where was it found? Was it disturbed, grounded, possibly injured? Where is the bat now, and is it secure? This is also the moment to assess handling. Are gloves being used? Has the bat been boxed properly? That, for example. And you'd be amazed at how many escape at this stage. And finally, depending on the answers, we might need to involve other groups. That could be BCT, local bat groups, or medical teams like GP or the AE, if there's been a bite. So one of the most helpful things you can do on the phone, whether you're a vet, bat worker, or a rehabber, is to coach and reassure that finder through getting that bat safely into a box. So I usually say something like, of course you can do it. Just protect your hands. Do you have any gloves? Gardening gloves? Absolutely fine. If not, use 2 tea towels, and then just pop the tea towels over the bat, gently scoop the bat alongside the tea towels straight into the box we've already prepared right next to you, with very small air holes. So pop everything in, close the lid, secure it in place, because many bats escape at this stage. Make sure that box is definitely secure. Ideally take to the vets, otherwise place it somewhere quiet and dark while you're waiting for it to be transported. Now, in a vet clinic for clinical exam, handling, I can imagine, is quite intimidating, especially if you're not vaccinated against rabies. So ideally, you'd be working with a vaccinated colleague or bat carer, but if that's not available to you, then giving treatment and care should not be delayed because you are not vaccinated. You certainly shouldn't turn down to see a bat. Personally, and this is only my opinion, I think the 2-layer approach, gloves and a towel, offers really good protection when handling smaller UK and European species, as long as it's done calmly and ideally confidently, which I appreciate is difficult. Because when you're tense, that won't settle either. Now, this video, if I can start it playing, is actually a video from my wildlife vet bites. Because obviously it's a social media video, it is done very quickly, because I just, wanted to kind of instigate, show people how easy it can be. I appreciate the fact that I've done this quite a bit. Look how well that bat takes its water home. So, I'm going to talk along while that is recording in the background, but I'm going to highlight the key parts of that. So notice that I transfer it from one tea towel to a lighter colour tea towel. The main reason I do that is because I want to see easily if there's blood, because sometimes their hair can hide wounds quite easily, but blood often will be absorbed by the tea towel, and that will give me clues onto if I need to look further on. Now, this video actually does show the more thorough clinical examination approach. You'll learn slightly later as I go through this that I actually do this in 2 stages. So actually, this isn't quite how I would do my first clinical exam, because ultimately that I'm just really looking for seeing if there's obvious reasons to put it to sleep and to stabilise the bat further with giving it the initial care. However, obviously with vets who are slightly uncomfortable handling and so forth, they might just want to do it once and get it over and done with. And that's why I kind of decided to show a little bit more of a thorough one. And more so also to show them how easy it is. You know, there's nothing to be scared of. Okay. So another key thing you notice, you know, where you're going to be bitten is by the mouth. So you really don't want to put anything near there, certainly your fingers. So by placing that elbow in, automatically the wrist of the bat comes outwards. So head's here, you're pushing the elbow in, wrist goes outwards, you grab the wrist and you unfold it like a fan outwards. So that's because the bat's wing is just a hand, and that's how you kind of inspect, you know, the wing and the bones for fractures. One thing I do want to re-record this video actually, because what I do is I pick up the bat and turn it around because I'm so confident with bat handling myself. But actually, if you're not confident, it's on a T-tail. Just turn the T-tail round, and then you've got the other ring right there available to you to do exactly the same. Pop the elbow in, the wrist comes, it's just upside down at that point. Likewise with sexing, and certainly initially, and I probably, you know, I don't really care if it's a female or a boy, or I less care, should I say, if it's a female boy in winter time, for example. Yeah, I think that's probably true. The key thing I'm worried about is if it's a female who's potentially pregnant, heavily pregnant, and lactating. So that's your spring and summertime. I kind of really like to know that, because I might need, for example, if it's a lactating female, need to try and get a hold of a bat worker to go and check out that wrist to see if there's a baby there that we can reunite. And when the bat's literally on your hand, the tail is just there. So you can literally just flop it up like that or unfold it. And when you unfold it, just pop it like that. And it's all exposed, whether there's a penis there or a vulva. And now just be mindful. With penises, they do vary in shape. So if you're not sure, just grab yourself a little bit of a cotton bud, gently stroke it, and just make sure, you know, see if there's a little tiny flicker of a thing, because of, you know, it can sometimes, we can sometimes say that they're a female and actually they're a male. I've done this mistake, and I'm often laughed about it when I do, especially when you do it quickly. So yeah, just have a look. Okay, perfect. So another thing I should just say, if you want to get better with your handling, a really lovely way of doing it is get in contact with your bat group and seeing if they've got a local bat box scheme in your area. It's a fantastic way to see healthy bats in their environment. It's a great way to get data as well, how well they're doing, and you know, getting that handling experience of healthy bats who actually, if you can handle a healthy bat, you'll be able to handle a unwell cold bat, that's for sure. Okay, so get in contact. Also, if you're a volunteer, certainly in the UK, currently you're able to get free rabies vaccination, but yeah, obviously these things change, and rabies vaccination is actually hard to get hold of at the moment. Right, let's crack on. So we're going to have a short interlude now, as we would love to find out about your experiences with the reasons why bats come into care from your experience. So I'm going to hand back over to Fiona and Bronwyn, and I'll be back for the rest of the talk when we're finishing that. So over to the rest of the team. See you soon.
Thank you. Okay, that was great. I think Bronwyn's about to put up some other slides. I hope you're all still with us. And where we wanted to start was we're very interested. I mean, I do bat care, as I mentioned, and if I look down my WhatsApp chat over the last 2 weeks, there must have been at least 20 cases. I'd say the vast majority of ones that have passed through my phone have been bat-cat interactions. And so we'd really like to find out more about this, partly because obviously, or potentially, this has big implications for bat conservation, and we don't think that, or it'd be nice to find out more about that. And secondly, because this is one of the ways in which members of the public are coming into contact with their bats. That at the top here is a Ceratine that just about 3 days ago came into care after a cat attack. Okay. In terms of what it means for conservation, at the moment, we only know of a few cases where multiple bats are affected by cats. These were 2 recent cases. There was a paper from Leonardo Ancellotto and colleagues in Italy describing predation of Rhinolophus bats by cats, and then another report in the Netherlands. So what we thought we'd do is it would be great to get more information from you, because many of you we know are dealing with bats on a day-to-day basis. And I'm going to hand over to Bronwyn.
Great. Okay, so as part of our OneBAT project, we really want to gather more information on where cat attacks on bats are happening. Because at the moment, even at a country level, and certainly not a European level, we don't really have much quantitative data on where these attacks are happening. And from a kind of application point of view, if we can map where those kind of hotspots of cat attacks are happening, we can direct appropriate mitigation to those locations. So as Fiona and Heidi mentioned, we would really like to get some information from you, people who are practically involved in bat care. So as part of this, we have a larger questionnaire, which is the QR code on the right. This usually would take around 15-20 minutes to complete. But for the purposes of this webinar, we thought that we would create a slightly shorter version that we could actually do now. So if you've got your phones available, you can use the QR code to scan the link, and I'm also going to put the link in the chat so that everyone has access to it. And we'll have a kind of short 5-minute break while everyone has a go at doing that.
If you have any issues, you can just write in the chat. Oh, and Bronwyn's also put the link in there.
Mm-hmm. Yeah, and also if you have any questions about either the shorter or the longer questionnaire, then feel free to write them in the chat and we can ask them whilst we're having this break. So someone's asked, this is just if you are in Europe. Yes, that's correct. So this is just targeted at countries within Europe. But if you do have any insights from beyond Europe, then we'd be happy to hear them kind of anecdotally. So yeah.
Yeah, and we should say by Europe, we're being kind of generous in our definition of Europe. So we're interested in members of the EU, but also range states, basically anyone that's covered by the Eurobats agreement. Yeah, and Amanda, that's absolutely fine. If you've already done it, don't do it again.
Yeah, and I think someone said, do we need to choose one to answer or can we do both? So, I mean, it's up to you really. If you'd like to do the short questionnaire now and then have a go at the longer one later, then that's absolutely fine. But if you feel that you'd rather just do the full one, that's also okay. It just is slightly more time consuming.
Melissa, that's really, really interesting. Thank you for sharing that. We haven't come across that.
Someone said, do you mind if you share the link? Yes, please. I should have said, actually, if you have any colleagues or friends or contacts who you think might be able to participate in the study, then please do share the link to both questionnaires. This is aimed specifically at people who are kind of practically involved in vet care, but yeah, it would be great if you could share this more widely.
I think a few people are joining on their phones. What we can do is perhaps send out the link again to everybody after this meeting, so that those who haven't been able to do it now can do it later if they want to.
Yeah.
Obviously, if
I think maybe we'll give everyone another 2 or 3 minutes, and then we'll send out the links. So if you'd like to do it after the webinar, then you're very welcome to. So there's a question, will we have access to the recording of this webinar? So I believe that all of the OneBAT webinars are recorded and they'll be made available on YouTube. I think Andrea can confirm this.
Yeah, sure. Yeah, they're all available on our YouTube channel. I will leave the link here so everyone can have access to it.
Okay, so I think we've all had around 5 minutes to have a go at the mini questionnaire, and yeah, again, I'm happy for everyone to have a go at this after the session. So as well as the questionnaire, we also have another request to give to you. So one of the things that we can't necessarily get at from a questionnaire is those vets that have come into care where it's not immediately obvious that the cause of them being admitted into care is from a cat. So sometimes it may be really, really obvious that a cat's been involved, for example, if a cat has brought the bat in. But sometimes bats might be found grounded by either a person or a dog, for example, and it's not super obvious that a cat has been involved. So what we'd like to do is get at more kind of quantitative information on the rates of contact between cats and bats. And how we'd like to do this is using genetic techniques. So participants in this follow-up study will be sent equipment for swabbing of bats. So bats that are taken into care, even those that do not present as a cat-related attack, we'll ask you to swab those bats and send the swabs back to us. We'll then test the swabs for the presence of cat DNA. And this approach is based on a smaller study that was conducted in the UK a few years ago, but we'd really like to expand this out to the rest of Europe. So we've got another QR code for you, but again, I'll add the link into the chat for everyone. But yeah, this is just a link to basically provide contact details, so your postal address and email, so we can send the equipment and instructions out to you. I'll just leave this up for a minute or so for people to scan the QR code. Okay. Sorry, let me just get the slide back up. Okay. So we have another kind of tool to share. So we've been working with the developer of the wildlife rescue platform, which is an online platform where bat carers, wildlife rescue centres, and vets can basically systematically record information about the bats, or it's actually designed for any wildlife, can record information about them being brought into care. So the really cool thing is that for each bat, you can create a new unique admission. And then if you encounter the same individual again, or you look after the individual over a period of time, you can update that record and keep recording information about that individual. And you can also get a nice dashboard to show you how many admissions you've done over the year, how many different species, etc. So one of the things that would be really useful is if you could use this platform and also agree for your data to be used for research purposes. And yes, it's down in India's system and it's completely free. With regard to kind of data privacy, all of the data that will be shared with us is completely anonymized. It's not used for any kind of commercial purposes, and it will just be aggregated into a single data set. So none of your personal information will be shared. And obviously, if you want to withdraw your data from research purposes, you are able to do that at any time. The link is here. It's just rescuecentre.org.uk, and it's really great. And we really recommend using this platform. One final request from our OneBAT colleagues is that if you have any bat carcasses, please submit them to, or in the UK, that this would be APHA, the Animal and Plant Health Agency, but within the EU, please submit them to the European Union Reference Laboratory for rabies. Okay, I think that is it from us. So now we can see Heidi's second part of Heidi's talk, and then we'll have the opportunity to ask questions to Heidi at the end. Okay, now for part two.
And we're off again. Welcome to part two. Got a lot to cover, so let's just crack on. So that first assessment, and the first thing to ask is, do I need to stabilise, or is this a case where euthanasia is the kindest option? Now, severe fractures, major trauma, or neurological signs often mean a very poor prognosis. And we owe it to these bats to make that decision early, not after several of hours of extended prolonged suffering. Now, some experienced wildlife vets do attempt pinning or surgical repair of some fractures in certain cases, but this is a highly specialised area and one that still needs more published research on the long-term outcomes. So it's not something to attempt lightly, and definitely not without discussion with an expert and proper follow-up plans. Now, next we gather just the basics information, enough to guide that initial care. So if you happen to know the age, the sex, species, you know, if it's clear, you're not doing a thorough thing, okay? But it can often help inform everything from fluid needs to early prognosis. And don't forget to record your findings or notes that you haven't been able to check, like unknown if can fly. So, especially if you're working in a team, this helps to ensure nothing gets missed later. Now, supportive care starts immediately. So warmth is often the most urgent thing that they need, fluids and pain relief, even before we've finished that full assessment. So don't wait for the perfect moment, just start gently. Once the bat is stable, that's when we move on to a much more thorough second assessment, but only if they've passed this initial triage. You can't fix a bat that's cold, shocked and starving. That's why stabilisation comes first, not diagnostics, not antibiotics, and maybe not even splints. And actually, no, I will say that with certainty, not splints. And here's what I mean by that. So warmth. I choose warmth as my first one because if that bat is cold to the touch, no medication will be absorbed properly. Just being inside though will be hopefully warm, depending where you are, where you live, etc. And but extra warmth can be provided, say for example, in an incubator or a hot water bottle, along the side of the bat's box, or even maybe within. But just make sure that they can move away because of you don't want them to overheat either, especially if they can't move away from it. So next we go with fluids. Most grounded bats will be dehydrated, either from shock, stress, or lack of access to water. So you can offer small amounts orally. In the majority of cases, I will do orally. Very rarely, I will do subcutaneously, but obviously I will in some cases. And it does depend on the situation, also who is given it and what training they have had, etc. Then pain relief. Now, I think we often underdose for pain relief. I don't think we recognise pain in wildlife like we do. They can't tell us. I mean, let's face it. Do you know I've got a headache at the moment? I've got a cough, got a sore throat. No, you don't. So, but I'm able to vocalise that to you, whereas a bat can't. And there are pain scores in some animals, but we don't really have that data with our bats, and especially if you're quite new to the bat situation, you may not necessarily know. So my preference always is, if in doubt, I will give pain relief. Okay, now let's go for the next one. So nutrition. Now nutrition, to be fair, I've popped it here because I do think it's important that they have access to it, okay? But again, the first thing is warm and hydrated. So maybe it's not necessarily should be here, maybe potentially in the second one. But I feel like it's important, especially if I was concerned of hypoglycemia, for example. So like if I wanted that emergency food, I might even think of honey, for example, or something a little bit more permanent, which would be like soft dog food. This is an emergency because ideally it would be decapitated mealworms and offered in small amounts. But I don't expect most vet practices will even have that. And as I said, don't need to rush it too soon, but it's kind of a balancing act. So sometimes if they're really bad, and I think certainly with those youngsters, if I worry that they've been away from mum too long, then I might just give them that little bit of energy boost. But I mean a little bit. Certainly if you're doing honey, it's just the teeniest of amount. Okay. Obviously, with little ones, you're thinking about milk substitutes as well, but it will depend on your situation whether you're reuniting mum or not. So we'll potentially won't have time to talk more about that at this present in this talk anyway. And then the other thing, most important thing, is rest and quiet. We often forget about this one as part of the stabilisation. And obviously vets are not necessarily the most quiet or places, the barking dogs and so forth. And that's just normal part of a busy clinic. But if we can pop the bat somewhere which is relatively quiet, it will go a long way. Right, so let's think, hopefully they will stabilise, and that was great. Okay, and then at that point you can move on to a much more focused treatment and assessment. But if they don't, it may be time to reassess whether euthanasia is indeed the kindest outcome. Reassess on repeat. That's why I always think, don't delay that decision if it's clear that sadly they're not improving. So once your bat is warm and hydrated and stable, you can move on to the much more detailed second assessment. And at this point, we're checking how they responded to the initial care and deciding what comes next. And as always, record your findings. So let's start with a top-down kind of clinical checklist. The face, are the eyes open? Any facial swelling, nasal discharge, any kind of trauma? Have a look at that jaw, alignment. Lungs, look at the breathing effort. Any sign, it could also be signs of pain, but it could be disease as well. Wings and skin, look for tears, crusts, mites or wounds. It can be quite normal for these guys to have a small amount of mites, depending on the season. If it's come from a maternity roost, it might be a little bit more full blown, should I say. But yeah, think of this as like kind of a clinical exam that you would do for your cats and your dogs, but just you're kind of adapting it. So a few little mites, it's not a problem, but a lot of them kind of also tells you about the chronicness potentially. Now, next, weigh them if you can. Now, how you do that will very much depend on your setup at your vet clinic, and I can certainly go through how we do that if we get time in the Q&As, if you'd like me to. But to get it right now, one, you need it for the drugs. So potentially you might have already done it actually for the pain relief, of course. But if you haven't done that, you're definitely doing it here, because it also helps tracking response of care for over time. Helps you also to guide for species as well. So if you happen to see any feces, you might want to keep them, because that's obviously the feces that they've eaten in the wild that can help guide you. Also, if they've got diarrhea, that kind of thing. Okay. And just don't forget also, now we're looking for the basic clues on whether this bat is a juvenile, if it's female, is she pregnant, is she lactating. That might make you think about, you need to get in contact to see if there's a baby out there. Can the bat fly? Obviously do that in a secure area as well. Then we ask, does this bat need more focused treatment, like antibiotics? If there's, I always think, where's the pus? If you see pus, then you're probably thinking that antibiotics is needed. Okay. Now, or diagnostics such as imaging, and what I mean by that is x-rays. Okay. If so, if we're thinking about x-rays, now's the time to kind of plan it in, okay, in a sense of when are we likely to do it. I often don't go into x-rays straight away. I definitely like to stabilize them first, but of course it might depend on people, timing, where the weekend is, everything else like that. So just plan it so it's in place, hopefully, and have those conversations with the rehab about costs as well. Okay. But equally, if they're not improving, especially after the 48 hours of stabilisation, it's time to gently reassess. So don't keep treating for the sake of doing something. Their welfare always comes first. So here's an annotated photo of bat anatomy, and I'm going to try to use a pointer. Yeah, look at that. So the thumb sits here. And it's used for climbing or even grooming. Okay, then we have the second all the way to the fifth fingers. Okay, and they form the surface of the wing, and the bat's wing, it really is just an extended hand. Okay, the third and the fourth fingers, These are especially important because they form the central kind of engine of powered flight. And then lower down, you see the forearm. So you can just about see that there. Sorry, there. You've got the tail membrane, calca. These are things that are key for lift, steering, control, and catching food. So when a bat comes in with, say, for example, wing damage, which digit is affected really matters a lot. Damage to the third and the fourth finger, especially if there's shortening or asymmetry, may mean that controlled flight isn't possible. Distilled fractures or even some heel tears may not impact flight at all. And this is where collaboration really makes a huge difference. And this is where working with a bat conservationist or an experienced bat worker can really be valuable. They bring a different kind of knowledge, not just about flight, but about, how that species lives in the wild, for example, how it flies, how it roosts, how it forages, what kind of flight matters for survival, that kind of thing, that kind of practical field insight, which really helps us make better decisions about which injuries really matter and which bats might adapt and do well, even if they're not quite perfect on paper. And I guess this is also a good point to mention about post-release monitoring, actually, and that can be really helpful. It is common that I've seen in bat boxes, for example, that there can be common injuries, but we want to make sure that this bat on release is really truly releasable and thrives. So working with someone who can observe the flight outdoors and share follow-up data, that kind of thing, brings us closer to evidence-based medicine. Identifying the species of a bat isn't just a nice to know. It can generally change how we manage care. Some species are easy to spot from things like ear shape with the brown long ears, tragus length or shape, or even the muzzle profile, like the horseshoes, for example. Others need a little more work, maybe the forearm measurement or a closer look at the teeth, tail, or even penis shape. The Bat Care Guidelines and FSC charts, charts include brilliant reference tables for species, weight, forearm length, and even distribution. If you're not sure, it's really worth having a go and then checking with someone more experienced if needed. Species ID matters for lots of reasons. It helps us understand normal weight ranges, expected behaviour, and how to plan for release. This is also a moment where working with a bat ecologist or experienced bat carer can really help. They'll be able to help with bat ID, as I mentioned, and if the location of the bat is unknown, they can also help you narrow down likely roosting areas and give context on what normal weight is now even. So species ID is more than just a label. It's a foundation for personalised care, appropriate treatment decisions, and successful welfare-led release. And bats grow fast, and that can really make the aging process sometimes a little tricky. This lineup of pipistrelle pups shows just how rapidly they can change. Day 0, they're pink, and then as you can see here from day 3, they've got that brown, slightly kind of stubble growth, and then flight ready by day 35. They can reach adult size in just a few weeks. That's why forearm measurements is so useful. Ideally, you would use calipers because it can help you estimate age or track growth over time, especially in pups. It's also not just about size. Even when a bat looks fully grown, you can often still tell if it's a juvenile from the shape of its joints, particularly the finger joints. This takes a little practice and input from potentially an experienced bat worker or an ecologist can really help if you're unsure if it's looking knobbly or a rectangular shape and translucent in those juveniles. And that's important because pups are often mistaken for adults and vice versa, especially when they're fully furred, grounded, and you're seeing them kind of out of context. That age isn't just about labelling, it helps us spot red flags early, like stunted growth or early signs of metabolic disease in those hand-reared pups. So age really isn't just a number. It's about understanding where that bat is developmentally. And I'll say that again, developmentally, and whether their recovery is keeping pace with their life stage. You recognise this slide from earlier, and I'm just bringing it back briefly to remind of those different sections, really categories, for the main reasons why they're brought into care, because it obviously affects treatment. So disturbance, injured, unwell, and juveniles. I'm going to quickly skim through them all. So one of the most common reasons bats are brought into care is simply disturbance. This includes situations like bats roosting in sheds or outbuildings that get opened unexpectedly, or bats being trapped indoors, often in homes, schools, or even shops. In these cases, the bat is usually otherwise well, it just ended up in the wrong place at the wrong time. If after assessment the bat is bright, alert, uninjured and flying normally, the best outcome is just to release exactly where it was found, maybe not inside a shop, for example, but just outside, ideally at dusk and away from cats or busy areas. Releasing at the point of origin is really important because bats are very loyal to their roosts, and releasing them elsewhere can cause unnecessary stress or disorientation. Oh yes, and of course, if there's any doubt if the bat is grounded, underweight, or behaving unusually, it's always safer to bring it in for a short period of assessment and just support it and review later. So if you're unsure, then just keep it in. Another common presentation, and sometimes the trickiest, is injury. These often result in puncture wounds, wing tears, fractures, or even joint swelling. Sometimes it's obvious, like an exposed bone, but other times it's more subtle, like swelling in the wrist or shoulder. But they have too, so don't forget to compare, just like this door Benton here who's got a swollen wrist. This is where good clinical exam and, when possible, potentially x-rays really matter. Whatever the cause, the basics are the same. So that's warmth, fluids, and pain relief come first. Antibiotics may be appropriate, especially for suspected infection after a cat bite. But remember, a lot of these bats would die, sadly, because of the trauma or shock, not necessarily due to sepsis. And the evidence base is thin, especially in those where you're not actually seeing any wounds. And there's a question whether we should be giving antibiotics in those cases if you're not seeing wounds. Sadly, if the injuries are just too severe and incapable with flight or quality of life, euthanasia is the most ethical choice. And that's never easy, but it's sometimes the kindest. A quick shout out here, I'll be covering X-ray interpretation, common injuries, and much more detailed treatment protocols in an upcoming Wildlife Vet Bites course. So if you're a vet or a vet nurse and you want to be a bit more confident in handling these cases and knowing how to treat and diagnose, stay tuned. Sorry for the plug. Let's move on to the cases where the bat is clearly unwell but not necessarily injured. These are often some of the most challenging to assess early on because the symptoms can be very vague and they often decline rapidly without obvious trauma. Common causes include emaciation, particularly in juveniles, or bats at the end of hibernation, particularly in bad years where temperatures may have fluctuated or after several disturbances, sadly. You'll also see infections, sometimes bacterial, but sometimes fungal. Keep an eye out for that. And more rarely, systemic disease. Or is it? Problem is we don't often do blood tests, so we don't necessarily know the frequency of or occurrence of kidney or liver disease, for example. It's important to consider not just what you see on the outside, but what might be going on internally. Initial care focuses on the basics. So you've got this now. Repeat after me. Warmth, fluids, and pain relief come first. And don't underestimate how much good nutrition and proper rest can help turn a case around. A bat that's just cold, hungry, and stressed can really look critically ill. Let's stabilize it first. And surprisingly well, these guys can often have their needs met and just turn that corner. If there's evidence of infection, try to determine whether it's likely bacterial or fungal by your diagnostics. And this is working with a supportive vet can really help. As always, stabilise first, then reassess. Not every bat will recover, and we need to stay honest about the quality of life, especially if they remain weak, unresponsive, or unable to feed, want to feed. But some will surprise you, so give them a fair chance, but let their response guide you to the next step, and that really depends on how critical they are. So, for example, a bat who's very, very unwell, I would want to see at least some improvement quite quickly. And if I'm not seeing at least something quickly within an hour or two, I'll be reassessing. Obviously, they're not that bad, but you're still a bit concerned. That reassessment time will be a little bit longer. So it is very case dependent, but still very important all the same. So let's revisit juveniles, and let's be honest, the most fun cases we see in vet rehabilitation, certainly for me. The key is knowing when intervention is needed and when a reunion attempt might work. If the pup is bright, warm, hydrated and cooling, reuniting with mum should always be considered first, ideally. If they stay in care, they need a graduated setup, which allow them to be able to stretch their wings, do small flights first with small flight enclosures like the one pictured here at the top, and then eventually graduate into the full outdoor flight practice, ideally practicing even, getting their own insects, flying insects, so hunting, for example. It's really a lot of work, especially feeding and monitoring progress, but incredibly rewarding when it goes well. And that leads to an important point. We still know very, very little about what happens after release. And these two studies are pretty much all we've got. Having said that, there's a lot of unpublished work out there. But, for us to network more and talk more and to reassure ourselves that what we're doing is best, we need much more evidence on it. I mean, they're very useful, but they're species limited, short term, and they don't really tell us more about the long-term survival, such as breeding success, for example. So while hand rearing can be successful, absolutely, reuniting is best. And if hand rearing bats, they need exposure to flight cage to be successful. And we really need more structured follow-up to want to improve from, the hope of that it's going to be okay to evidence. Particularly important, especially in the bigger bat species as well. And before we all go flying off, let's talk about what makes a bat actually ready for release. First, they need to pass the flight testing stage in a safe enclosed space, ideally large enough to test sustained flight. We're looking for controlled landings, the possibility to turn and avoid obstacles, and echolocation use, especially in those youngsters. Not just about getting airborne or crashing into the nearest T-tail, okay? In some species, we would even test them getting off from the floor. They also need to be clinically ready, stable weight, normal wing movement, and no signs of pain or fatigue after flying. Full recovery from wounds, fractures, or soft tissue trauma is essential. Timing also matters. We want to release at dusk dusk and in warm, dry weather, ideally close to where they were found. And certainly with juveniles, we want a period of good weather too. Juveniles do need a bit more care and observation before release, ideally with post-release monitoring if possible, or at least some local support. So a soft release, ideally, rather than hard, but that's just my preference, and we need more data on that. Before we wrap up, here are some overarching principles that are useful to keep in mind, especially when working with bats or other small wild patients. So the first and the big one, there are no medications licensed for the use in bats. That means vets are working under the cascade, making decisions case by case, balancing welfare, evidence, and risk. It's not about throwing drugs at a problem. It's about knowing when and how to act responsibly. Just because they're small doesn't mean they don't deserve proper care. Small size doesn't mean no dose. It's just about calculations and dilutions. That's one reason why I built the Wildlife Vet Bites dilution dosing resource. It helps make what appears to be complicated situation or a difficult situation simple. That's the way I work. I'm actually very good at making complicated or difficult things simple. Helps my own brain anyway. Any medication we give, whether it's antibiotic or antiparasite treatment, needs to be justified based on the animal in front of us. Most importantly, whether the benefit outweighs the risk, because we're very much concerned about overuse in these treatments. With antibiotics in particular, it's worth remembering we don't yet know whether they truly improve survival in cat attack cases, especially where there's no wounds. So we need to be thoughtful, not automatic. And finally, perhaps the most important point, know your role and know your limits. It's okay to say no. You don't have to do everything. It's okay to say, I'm not sure, or this is just beyond what I can manage. Having clear standard operating procedures, so SOPs, in place helps when it comes to communication and agreement with vets and rehabbers. So does protecting yourself from burnout. These cases are emotional, time intensive, and sometimes end in euthanasia. And it's okay to admit that it's hard. So whether you're a vet, a nurse, a rehab, or somewhere in between, supporting bat welfare isn't about doing everything perfectly. It's about staying grounded, making conscious decisions, and working together as a team. So before we finish, I just want to pull back and look at the bigger picture, because boy, have we skimmed through a lot. That's definitely be a bit of a flying race. When it comes to evidence, what we actually know is still limited. Most studies focus on the common species, and even then the sample sizes are small and mostly report on short-term survival. That is useful, but it's only part of the story. We still don't have any good data on cat deterrence or how best to educate public in changing perceptions, how to best protect bats from cats. What the outcomes are for different bat species, or what should we be doing with vagrant or non-local bats. There are so many thoughtful questions being asked, but not enough structured answers yet. But this matters because right now we're often guessing and not measuring. We don't always know whether what we are doing is truly helping bats or just making us feel better. That doesn't mean we stop. Gosh, no, I mean, I love my job, but it does mean that we need to reflect, stay humble, and stay curious. It's going to take all of us, vets, rehabbers, ecologists, transporters, the public, researchers like OneBAT, to piece all this together. And I believe we can, step by step, as long as we keep pushing forward. Because really, the best outcome really isn't treating more bats. It's fewer bats needing that treatment. Let's stop them coming into care and help them thrive without us. So to finish, a few key takeaways other than fluids, warmth, and pain relief, I hope you'll carry away with you. So every bat matters, and so does every person in a team. Whether you're a vet, a rehabber, a researcher, someone transporting bats at 10 p.m. in the rain, you're part of this puzzle and your role matters. Ethical, welfare-led care is conservation, in my opinion. It's not a separate track. When we make kind, evidence-based, informed decisions, we're protecting species as well as individuals. But we still need better data, especially around what happens after release. Post-release outcomes matter because they tell us whether what we're doing is actually working. And none of us can answer that alone. It takes joined up collaboration, shared insights, and a willingness to learn from each other. Thank you. Thank you so much for caring, for showing up, for helping bats. And even when it's messy, emotional, or uncertain, the more we connect across the roles, the more bats we help, and the better we get and letting them thrive without us. Thank you.
Thank you so
Thanks
much,
so
Heidi.
much. That was brilliant.
Hello.
There she is. There she is. Heidi, we've got quite a lot of questions coming in the chat. I wonder whether we can take some of those, and then if other people have questions, they can either type them or put their hands up.
Thank you. So
Okay. Sorry, I don't know who is speaking, but okay. Right. So one question was about your hang on, trying to find it now. Right. First question was how do you feel about using blended honeybee drone brood as emergency food? I've never heard of that.
I can't say I'm an expert either, I'm going to be honest with you. Now, the reason why, because actually the question I normally get asked is why honey and not sugar? But if I can recollect, so it was drone. So isn't that just the first honey that they make? Isn't it got extra protein and so forth? I mean, I'm going to be... Yeah, I should quickly look it up, shouldn't I? It's not something I've got easily available to me, you know, and when I get asked about honey and sugar, ultimately in the crisis situation, you use whatever you've got, you know, so that's why, you know, I normally go for honey because I have been told that it's more available, digestible, so you get that energy source quicker. I don't actually know, I'm just trying to think now if that's actually factually true, but that's what I've got in my head somewhere. Yeah. So
I think that's
so that's
right.
why I was going to say I'm pretty sure that's right. So yeah, I would go for honey, but you know, not everyone has honey, so sugar would also be fine. You just want to give them a little bit of a glucose, you know, up. And I can't imagine the drone would be bad, but I'm so sorry, I don't know an awful lot about it.
Okay, and there was a question about your preferred source of medication dosages. So you helpfully put up the little thing about how to convert the dose rates.
Yep.
But then where do people go to find, you know, basic information?
Yeah, so I wrote an article which is in the in Companions, which actually the link still works at the moment, and it's open access, but it's obviously targeted at vets. So there's my medication dosages are in that. I have to be careful regards to talking about dosages because of as a vet, and I'm not allowed to discuss dosages to other non-vets, because then all of a sudden the animals can become under my care, so it's just a little bit of a dodgy area. So okay. But that also the BSAVA manual for wildlife, they have a chapter on bats. They've got a list there. They're kind of my go-tos. And if I'm using medication that I don't have a BAT dose for, and I haven't found it elsewhere, then I normally go for the low end of my dose that I'm normally comfortable with another species.
Thank you. There was also a question about electrolyte solutions and what you would recommend. Okay, so sorry, I'm just being, so I'm going to be honest with you. I use Hartman's
There are others. There are other literaries. I don't know. I'm ever so sorry. That's quite a particular thing because I'm just being mindful. So
I think we're talking about oral electrolytes.
Oral electrolytes.
For fluid.
So
yeah.
So I would use lactate, if I'm honest with you. That's kind of my go-to, but there are various ones out there, and there's lots of non-POM ones as well. So, you know, you could have a look at that. I'd probably say speak to your vet.
But you say there's lots of non-prescription ones that like Oralade, for example, is one that's sold for cats that's not prescription, and bats seem to love it.
Yeah.
Okay. If I'm allowed, I had a question that I'd only just recently thought about, which is about refeeding syndrome.
Yes.
And do we think this is an issue for bats? I mean, often personally, I would try to give, if I think a bat is really emaciated, I'll try and just give fluid. But then I'm never quite sure at what point do I stop just giving fluid, and when do I need to start poking food into it? Yeah.
So that's why I kind of go for so we don't really know. The truth of the matter, we don't know. Okay. It's often discussed as well in hedgehogs. I mean, the benefit of actually hedgehogs and bats is that we do actually know that they do hibernate. So they go for a long period of time where they don't eat, and then they manage. But obviously, they're generally healthy, but they might still be dehydrated after that period. You know, so. My go-to is always the warmth, always the fluids, and then after that, if I'm concerned about glucose, you know, that would be my sugar. But I tend to not over worry, if I'm being really honest. If I feel the bat is capable of swallowing, then I'm happy. If I don't think the bat is capable of swallowing, and there might be a risk of aspiration, I will not be shoving food in its face. I will, you know, be holding off.
Thank you. There was a question about test flights.
Yeah.
And I wonder if you can just elaborate a little bit more. So, you mentioned you sometimes do a test flight in some species from the floor. Somebody was interested in that.
So I've often. Once I go.
Go ahead. Go ahead.
So generally, the smaller species I would try on the floor. In fact, the baby pipistrelles, they actually do that quite happily to start off with. You know, I wouldn't obviously expect them to go and fly, but yeah, pipistrelles definitely do it from the floor. I've seen brown long-eared doing it from the floor. The ones I see struggle are the bigger, the heavier species. But I like to see what they do, how they respond to that. Because often a bat will see where the wall is and go for it and then climb up and then go. So I definitely like to see how they respond to being on the floor. And then if they're able.
I wonder if you can elaborate a bit more, perhaps for people who aren't so familiar with having bats in care, of what you might mean about sustained flight. Like, how long are you looking for the bat to continue flying for?
So ideally as long as possible, I'm going to be absolutely honest with you, because these guys, you know, we're going to be releasing them, we're expecting them to do a marathon, you know, potentially. Then there's always going to be a compromise though, because of, in your situation, you might be doing this with work and so forth. So I'd like at least a minimum of 20 minutes. They often will get bored quite quickly though, you know, so you've got to try and make it quite difficult for them to, you know, to land, you know, tease them, obstruct, you know, move your arms around, that kind of thing. You want to see that they're not tiring, you know, you want to see they're still able. I find, you know, once I'm happy that they can fly and so forth, then making their landing difficult is great. You know, it's slightly torturous, I guess, but you know, so but ultimately it's really to ensure that they've got that level of fitness. But you really do need to make sure they're warm enough, though. That's what I would say is key. Often when I'm told this bat can't fly, it's because sadly they've just not had time to warm up. And looking at that bat and making sure it's really nice and vibrated. Those hand warmer, I've got a couple of those LED warmer things. They can really help, I find.
Brilliant. Nikki is asking, wonderful Heidi, my question, what type of wing injuries would you consider a PTS case? She has an example, a grounded bat with a healed wing injury. I'm not quite sure that happens very often, but maybe the first part.
Yeah, so definitely an open fracture for me. So that would be when you can actually see the bone and it's outside. That that generally is probably going to be a PTS for me. The only time I would potentially, I mean, it's slightly different for me because I am a wildlife vet, therefore my exposure to these cases is higher. If I had a really nice break in a big species, or a big arm, and it just literally kind of came out, then that might be something that I might, away from the joint, that kind of thing, I might consider that. But generally speaking, if they're open and I'm seeing bones, that's most of the time I'd be put in sleep. If they're closed joints, that's closed fractures. So what I mean by that is they're still contained within the membrane. If it's a finger or you know, the skin in the forearm or the ulna, they are ones that I get a bit more excited about because I feel like I can do a bit more vetty stuff. But yeah, the difficulty with these ones is to actually find a good break is, you know, a really good candidate, you know, in the sense of it's a really good, ideally if I could have a checklist of what I'd really like, I'd want a young bat, ideally a big bat, but then I also want to have a nice big flight cage for that big bat, you know. So, and then also making sure that there's no issues with the time of year, where to release, that I can do some post-release monitoring, that kind of thing. So I really think quite heavily on these cases, especially if it's a big bone. The ones that like the fifth finger, you know, those in a distal, like quite often they can have a really tiny fracture there. They're you know, happy days. I'm happy with that. I guess I can I say happy, I'm not happy with any injury, am I? But it's one of the nicer ones. Regards to membrane, I just, it's horrible when you say I love, isn't it? But it's just, it's nice when you know you can treat something. So with the wing tears, the nicer ones are when the wing, you know, the circle is within the actual membrane, so it's not involving an edge like a body wall or the edge of the wing. Some vets do things differently. Some vets will suture. I don't suture because I find that, especially if it's that, very rarely would I consider it. But the problem is that I find is that you can compromise the wing shape. So I would have to be really happy that by me by suturing it, it's not going to compromise the other one. And that's what's so lovely, is they've got pair, so you can compare one side with the other.
Perfect, thank you. We just had some long-term studies on post-release survival of hand-reared pups, which is nice. Thank you for those suggestions. They're in the chat. And Sarah says, for emaciated and weak individuals, I started to use MRA'd carnivore care to start gavage. Does it sound okay, or should I use something else? When the bat's better, I go for mealworms.
Yeah, I think it's one of those things that you know, when I first started a long time, you know, we often said about dog food, and then all of a sudden it was like frowned upon. I think the nice thing about that is some vets will have access to that, so where they certainly won't have mealworms most of the time. So I think that's, if you've got access to that, I'd say great.
Cool. Sorry, I'm just aware of time, so I'm sort of skipping through a bit. How long would you wait to euthanize a bat that had a swollen wrist which doesn't seem to go down with antibiotics?
I would ask you why you're using antibiotics and not non-steroidals. It would be my answer to that. So sorry. No. So sorry for that, and I'm so don't know who the person who asked me that question. So
It's Charlie.
sorry, Charlie. I know Charlie. So my preference is that it would be non-steroidals and another form of pain relief potentially. Okay, so I would be going for opioids. That's probably all I can say at this point. Well, I could probably say more, but I normally get the buprenorphine is my go-to, but you have to just be mindful that what you have access. We've got a varied audience here, so you know the opioids are controlled drugs, and I'm not an expert outside of UK when it comes to controlled drugs and what's controlled and what's not. So yes, so with a swollen joint, I'd also be making sure there was no fracture. Of course, how are you going to know in a wrist unless it's really dislocated, because I find that's really difficult even with a dental x-ray plate. So but yeah, non-steroidals, extra pain relief. That's not to say I wouldn't use antibiotics, so sorry, Charlie. It's certainly if there was trauma in the sense of, you know, a cat attack, I would, because with a joint, you know, infection is definitely with bacteria especially if there's a wound. I would say if there wasn't a wound, I do wonder.
Okay, thank you. And perhaps the final question is, bats that are found in winter, do you overwinter in a hibernation state?
Oh, so I've done different things at different times. I must admit, my preference now, okay, is I like to offer the bat a choice, because that's exactly what it would do in the wild, you know, is if its roost site wasn't great, it would wake up, move on. Okay, so I generally I like flexiavians, so I often create a hot spot and a colder spot, and they're normally in a room that's not heated. Okay, but that would be dependent if the bat is healing. If the bat is healing from something, I want to keep them warm, because they need that warmth to be able to heal. So did I answer all of that question? Were they asking me when would I hibernate as well, or was they just asking about the temperatures?
I think both, yeah.
Okay, so adults, unless there was a reason, like, I'm just trying to think, like, unless there was a reason, like it was I'm trying to think of Europe, like, you know that this bat has migrated and you can't release it now because it would normally be elsewhere. We don't necessarily have that problem. Majority of the time, I'd probably say in the UK. With an adult bat, I have no qualms whatsoever. Get it out in the winter, as long as the period of time where you're releasing it is generally quite favourable for, you know. So ideally, I'd probably say 5 days. But adults know what they're doing, especially if you're releasing them where they came from. The difficulties come is if you don't know where they've come from, your weather isn't great, then I would probably keep them a little bit longer. If they're fighting disease, then absolutely, or healing. The other one would be the juveniles. Now, you know, I would probably hang on to them for a little bit longer until at least they've got the worst of it. But that's only if I've not managed to release them prior to the winter. And actually, our winters and autumns and springs and summers are not so separate anymore, you know. So it's being mindful of looking at the situation as it is currently. What's your temperature, you know, and going forward as well. And as I said, I give a lot of care to the juveniles. I mean, ideally, my perfect answer for the juveniles is they would be soft released rather than hard released. And what I mean by that is soft releases when they're supported. So they're still provided, you know, the door is open, but they still can come back and they can have food, compared to a hard release where you just release from the hand and off they go.
Mm-hmm. Okay, I think we've got 2 quick ones if we can,
Yep.
just to squash in.
I can't promise my answers are going to be correct. That's the problem.
That's all right. Well, Amanda says, I've seen red light therapy products promoted on bat rehab pages for speeding up healing. Are they any good?
So I think they definitely serve a purpose. I think it should be in line with discussions with your vet. I don't believe they cause harm, which is good. As long as I think of the bat. If the bat is one that is coping in care, and doesn't mind it, then I'll go. It's so difficult, isn't it? It's kind of, you have to be really in tune with your bat, because what's a happy bat versus what's a happy face versus a sad face of a bat, but I definitely think it's an exciting time. I think I really like to see the data on this.
Okay. And Sam says, I'm not a vet and very new to this. How do you know how much water to give and how often by mouth for very dehydrated bats?
Okay, so they're really good at telling you, I'd say. In the video I used a 1 ml pipette because that's what you have at vets generally, but I do have the much more smaller little tiny pipettes, which I find really nice because you can literally with that lip you can just kind of I don't know the technical name, Daniel would know, my husband. It's just a bowl with a little tiny straw thing, but yeah, you literally kind of pop the end of that into the corner of the mouth and just give them a tiny little and just see them swallow. Once they realize what you're going to do, often they are very happily will keep taking. I had a pipistrelle that was given birth literally 2 nights ago, and I actually offered her sugar water because I didn't have any honey, and she was on it, like literally taking it beautifully. Regards to the amounts, but a bat's not going to drink, like I would not be forcing it, certainly not orally. Now, regards to, there are rules, like there's guidance when it comes to subcutaneous amounts, but I probably, if it's okay with you, I won't talk about that now. But regards to dosages, for anyone who is a vet or a vet nurse, if you'd like me to talk through my dosages, and I'm ever so sorry, it's very hard, isn't it? I feel really mean by saying, I know how frustrating. I was a bat rehabber and it's very frustrating when you know more than the vet, and then I'm here now not giving that information. So I do apologize, but I've worked very hard for my vet degree. So but yeah, if you want that information, then feel free to contact me, and I'm very happy to talk through dosages like my sedation protocols for bats.
Great. Okay, I think we need to stop there. I think we could go on all night, but that was brilliant, Heidi. Thanks so much.
Thank
and
you.
Thanks to everybody who's been putting really useful information in the chat, including a link to the BCT Foundation course for people who want to get into bat care and don't know anything about it. For those of you who are vets or vet nurses, thank you for joining us. And I know Heidi, and I know that she'd be absolutely delighted to share her experience with you. As we say, we knew we were talking to a mixed group here, so there's obviously some things that are relevant to vets and others not. Okay, we're being asked, where will the recording be? And Andrea, could you answer that?
Yes, of course. It's gonna be on YouTube as soon as we have the video, have the recording. We're gonna upload it on the website and on the YouTube channel of OneBAT. I left the link. I will put it again here in the chat. There's the first 2 webinars that we held. First one was yours, Fiona, and it's gonna be all there.
Okay. Great, thank you. And please do share. Yeah, feel free to share or to point other people to those videos. That would be brilliant. And please do share those questionnaires and also the sign up QR code for our project looking at trying to identify cat-bat interactions, because I think that's something that we're really keen to know more about. Okay. Have you got anything else to add, Bronwyn, before we close?
No, I don't think so. Just to say that we'll email everyone who registered for the session with the links as well to the questionnaires, and also we can include the link to the BCT Bat Care course as well, if anyone's missed it.
Thank you. Okay, well, happy batting. Thanks, everybody. Have a lovely evening.